1. When developing a review curriculum for oncology nurses preparing for the ONCC exam, which approach best supports adult learning principles? A. Providing rote memorization drills. B. Encouraging self-directed case study analysis. C. Requiring learners to complete uniform worksheets. D. Limiting opportunities for learner interaction. 2. An oncology nurse educator designs a formative evaluation for ONCC exam prep. Which method is most effective in identifying knowledge gaps? A. A single summative multiple choice test. B. Peer evaluation without guidance. C. Frequent low-stakes quizzes with feedback. D. Random oral questioning without structure. 3. When creating a mentoring plan for nurses pursuing ONCC certification, which element ensures alignment with adult learning theory? A. Dictating fixed study schedules without flexibility. B. Encouraging reflection on personal practice experiences. C. Using abstract content unrelated to clinical scenarios. D. Requiring memorization of policy documents only. 4. During exam preparation workshops, which communication strategy best fosters critical thinking in oncology nurses? A. Delivering uninterrupted lectures. B. Facilitating open discussions with clinical examples. C. Limiting questions until after the session. D. Using only PowerPoint slides with definitions. 5. In curriculum development for ONCC certification, which step ensures regulatory compliance? A. Ignoring accreditation standards to save time. E. Aligning course outcomes with ONCC test blueprints. C. Designing sessions based solely on faculty preference. D. Eliminating references to current oncology guidelines. 6. Which evaluation method best measures both knowledge and application in oncology nursing certification prep? A. Multiple choice test only. B. OSCE with clinical case simulations. C. Attendance tracking sheets. D. Ungraded self-reflection journals only. 7. To ensure fairness in ONCC test preparation assessments, which principle should be prioritized? A. Consistency in scoring rubrics. B. Allowing different grading scales for each learner. C. Eliminating standard evaluation criteria. D. Providing feedback only to top performers. 8. An oncology nurse mentor is helping a mentee manage test anxiety. Which mentoring technique is most effective? A. Encouraging mindfulness and practice testing. B. Advising to avoid study groups. D. Discouraging breaks during study. 9. Which adult learning principle is applied when ONCC prep activities encourage learners to share their oncology practice stories? A. Readiness to learn. B. Problem-centered orientation. A. Experiential learning. 10. A nurse educator designs a curriculum for ONCC exam prep using Bloom's taxonomy. Which activity represents the highest level of learning? A. Listing chemotherapy side effects. B. Describing safe handling protocols. C. Evaluating complex oncology case studies. D. Defining oncology nursing terms. 11. During peer mentoring for ONCC certification, which activity promotes collaborative learning? A. Competitive test-taking sessions. E. Individual reading assignments only. C. Group analysis of mock case scenarios. D. Silent individual study with no feedback. 12. Which communication method is most effective when providing ONCC test feedback to adult learners? A. Immediate, specific, constructive feedback. B. Generalized comments without examples. C. Delayed responses weeks after testing. D. Negative criticism focused on weaknesses. 13. When developing ONCC review courses, Why is curriculum mapping important? A. To ensure alignment with the ONCC exam framework. B. To prioritize educator preferences. C. To reduce the number of test questions. D. To eliminate clinical practice content. 14. A nurse educator uses simulation exercises in ONCC exam prep. This method primarily enhances A. Passive memorization. B. Experiential learning and application. C. Rote repetition of facts. D. Limiting learner participation. 15. Which regulatory consideration is most important when preparing educational material for ONCC certification prep? A. Compliance with evidence-based oncology guidelines. B. Educator's personal clinical opinion. C. Excluding patient safety standards. D. Limiting updates to reduce workload. 16. In evaluating ONCC exam readiness, which strategy ensures objective assessment? A. Using standardized test blueprints and rubrics. B. Allowing learners to grade their own work. C. Adjusting scores based on participation. D. Skipping peer-reviewed evaluation tools. 17. An oncology nurse educator wants to support learners' intrinsic motivation. Which strategy is best? A. Linking learning outcomes to career advancement and patient care. B. Requiring study without context. C. Minimizing learner autonomy. D. Using punishment for incorrect answers. 18. During ONCC exam review, which mentoring approach best demonstrates role modeling? A. Sharing personal strategies for exam success. B. Limiting interaction to email reminders. C. Avoiding discussions about clinical practice. D. Withholding personal experiences. 19. In adult learning, self-assessment tools in ONCC test prep primarily foster A. B. Self-directed improvement and accountability. C. External motivation only. D. Dependency on instructors. 20. Which evaluation approach best balances formative and summative assessments in ONCC prep? A. Weekly quizzes plus a final practice exam. B. One end-of-course test only. C. Ungraded assignments without feedback. D. Random questions without alignment to outcomes. 21. In curriculum development for ONCC review, which strategy enhances knowledge transfer? A. Integrating clinical case scenarios with theory. Avoiding practice-based examples. C. Using unrelated subject matter. D. Teaching facts in isolation. 22. A mentor notices a mentee struggling with critical oncology content. What is the most effective next step? A. Develop a personalized study plan with feedback. B. Ignore the issue to promote independence. C. Assign additional rote memorization tasks. D. Reduce mentoring sessions. 23. Which communication technique best supports peer collaboration in ONCC study groups? A. Active listening with clarification questions. B. Interrupting to correct peers frequently. C. Withholding feedback until the final exam. D. Dominating discussions with personal stories. 24. When conducting ONCC prep workshops, which instructional design principle ensures learner engagement? A. Incorporating interactive problem-solving activities. B. Relying solely on lengthy lectures. C. Repeating identical PowerPoint slides. D. Restricting learners from asking questions. 25. Which regulatory standards should educators emphasize in ONCC preparation related to chemotherapy administration? A. OSHA and ONS safe handling guidelines. B. Nurses' personal routine. C. Outdated institutional habits. D. Informal staff suggestions. 26. A nurse educator uses portfolio assessment in ONCC exam prep. What is its primary advantage? A. Documenting growth in knowledge and application. B. Replacing standardized exams entirely. C. Eliminating the need for evaluation rubrics. D. Reducing learner accountability. 27. Which mentoring strategy aligns with Knoll's principles of andragogy? A. Encouraging learners to set their own learning goals. E. Imposing rigid study methods. C. Discouraging self-reflection. D. Avoiding feedback opportunities. 28. When evaluating ONCC exam practice performance, which tool provides the most reliable data? A. Validated practice tests modeled after ONCC standards. B. Random unvetted online quizzes. C. Informal group discussions only. D. Unstructured self-reports. 29. Which communication style is most effective when coaching learners on ONCC exam strategies? A. Supportive, clear, and collaborative. B. Directive, authoritarian, and rigid. C. Critical, without constructive feedback. D. Passive, with minimal engagement. 30. In adult learning, case-based discussions in ONCC prep primarily promote A. Application and problem solving. B. Memorization without context. C. Passive note-taking. D. Instructor-centered teaching.